Healthcare. Jamaica's public health system has reached a critical breaking point, marked by equipment failures, industrial action from almost every level of staff, as well as overcrowded and deteriorating facilities. Most recently, we're hearing about mold, which has locked down all 4 operating theatres in the Kingston Public Hospital. If you're
embarrassing, we need some milk!
As well as overcrowded and deteriorating facilities. Most recently, we're hearing about mold, which has locked down all 4 operating theatres in the Kingston Public Hospital. If you can't have operation in public, what does that mean? Member for Central St. Mary who knows about these things, it is a terrible situation.
Who is this?
The current administration's focus on public relations over effective service delivery has led to a near collapse in the public health sector. It is heartbreaking to watch the news or scroll through social media knowing that every week there's another grieving family crying out for change. Mr. Speaker, the debacle of Cornwall Regional Hospital's renovation, which after 7 years has seen its budget explode from 2 billion to over 21 billion and counting, and still nowhere near completion, is a testament to the shambolic project execution of this government. And Mr. Speaker, it is an absolute travesty that no one has been held accountable for the mother of all overruns. It is an unmitigated disgrace. Mr. Speaker, the PNP will undertake a major policy shift in the area of health, from a focus on mega infrastructure projects towards enhancing the delivery of healthcare across Jamaica's clinics and hospitals. Patients go to a hospital or a clinic to be diagnosed and treated, to return home alive and well. Jamaicans are crying out for this lack of basic services. They want it to be fixed, and the next PNP government will fix it.
We need help, Jesus. Jamaica need help. Shift the parliament. Shift the election. Shift everything. Remove them out there. Take out the cockroach. Take out the thief. Take out the criminal them. Take out the thief them. Take out the murderer them. Take out the gang leader them. Out of parliament. Take them out from Portland. Take them out. I hear Portland. Me I go to Portland. Why me I travel to Portland? Take out somebody, man or woman.
The health system needs to pivot away from primary care. We need to pivot away from secondary care to primary care and focus on extensive screening. 70% of colon cancers in Jamaica are now diagnosed at advanced stages. 70% of colon cancers diagnosed at advanced stages. 90% of breast cancers are detected by a lump over a year after the cancer started. 90%. Prostate cancer is primarily diagnosed after it has already spread. 50% of diabetics and 40% of hypertensive patients have no idea that they have those diseases. And tragically, the entirely preventable cervical cancer, cancer of the cervix in women, continues to claim so many lives of Jamaica's women. We will launch a national screening program to identify the diseases that are the top killers of Jamaicans and treat them early and more effectively. Prevent
We need help, Jesus. Jamaica need help. Shift the parliament. Shift the election. Shift everything. Remove them out there. Take out the cockroach. Take out the thief. Take out the criminal them. Take out the thief them. Take out the murderer them. Take out the gang leader them. Out of parliament. Take them out from Portland. Take them out. I hear Portland. Me I go to Portland. Why me I travel to Portland? Take out somebody, man or woman.
Effectively, killers of Jamaicans, and treat them early and more effectively. The disease. We will launch Jamaicans and treat them early and more effectively. Prevent. No, your name's a joke. Prevent. Joke in that. Prevent. No, your name's a joke. Prevent. Joke in that. Prevention and early treatment. Prevention and early treatment are easier, cheaper, and more effective than late cures. They specialize in gimmicks. We specialize in real solutions.
Embarrassing. We need some milk.
Cures. They specialize in gimmicks. We specialize in real solutions. Cures. They specialize in gimmicks. We specialize in real solutions to bring lasting. Specialize in gimmicks. We specialize in real solutions to bring lasting. Specialize in gimmicks. We specialize in real solutions to bring lasting. They specialize in gimmicks. We specialize in real solutions to bring lasting change.
Emotional damage. Embarrassing. We need some milk.
Hi, we need a divine intervention. We're tired of the labor rights. We're tired of the green people. We are so far. We can't take it no more. We need it. We need it. Help. Help. Jesus Christ of Nazareth. Psalm 46. God is our refuge and strength is a liberator.
Gimmicks. We specialize in real solutions to bring lasting change. Treating high blood pressure and diabetes effectively in our clinics will decrease the number of strokes, heart attacks, amputations, and kidney failures that are now overburdening hospitals, burdening livelihoods, and claiming lives. Mr. Speaker, despite of the grand announcements about the rehabilitation of health facilities, multiple operating theatres remain non-functional today at major institutions, including, as I've said, KPH, Cornwall Regional Hospital, St. Anne's Bay, Anotto Bay, and National Chest Hospital.
What can go so? What can go so? What can go so?
Treating high blood pressure and diabetes effectively in our clinics will decrease the number of strokes, heart attacks, amputations, and kidney failures that are now overburdening hospitals, burdening livelihoods, and claiming lives. Mr. Speaker, despite of the grand announcements about the rehabilitation of health facilities, multiple operating theatres remain non-functional today at major institutions, including, as I've said, KPH, Cornwall Regional Hospital, St. Anne's Bay, Anotto Bay, and National Chest Hospital. Under the next PNP government, every...
Embarrassing! We need some milk!
Yeah, Mr. I can't believe Christopher TUFTON in our parliament are going to people. Look on the disgrace, the disgusting behavior, and the man I talk about some serious topic. Look on the area.
Anotto Bay and National Chest Hospital. Under the next PNP government, every operating theatre will be refurbished so that each patient
tired of sitting in the
instead of waiting years for their surgery. I mean, I've seen in my constituency people waiting for years for a hernia operation, suffering pain. It's a terrible thing, man. They'll be able to have their procedures done quickly in well-equipped modern facilities. We will move from the cutting of ribbons today to the cutting of hernias tomorrow. emergency departments are severely overcrowded with patients who could be treated in urgent care facilities and sent home. I repeat, urgent care facilities and sent home. We will create urgent care centers island-wide where patients will have the option of not only seeing a doctor but having the relevant tests available for diagnosis.
Yo, me really not like that brother, you know. Me not like that brother, none at all.
And treatment. This, along with the expansion of emergency rooms and wards, will lead to shorter waiting times and end up with patients having to sleep on benches and floors once and for all. We need to end the indignity that people who need public health care in Jamaica are facing. The country is witnessing healthcare workers at all levels, from support staff to, for the first time in our history, medical consultants, taking industrial action due to poor working conditions, inadequate compensation, and mounting frustration with the system's deficiencies. And you can imagine working in the work environment that I've been describing, how that must be in terms of demoralization. Proper health care cannot be delivered by demoralized staff. The next PNP government will prioritize service delivery over options and gimmicks. We will service delivery over optics and gimmicks. We will ensure that staff are motivated, trained, and retained in the system through incentives such as sponsorships for advanced training, housing provisions, and adequate compensation, which is a goal that all of us have. The current government's approach to outsourcing diagnostic services instead of investing in hospital equipment has resulted in the accumulation of significant debt to private contractors in the health system. This causes service suspensions because they're not getting the money, which force patients to pay for private services, which they can't afford. We will prioritize the presence of functional radiology equipment in every parish hospital and put an end to hospital patients waiting on ambulances to take them elsewhere for urgent scans. We will ensure that every parish has a CT scan machine. And I will add, the children's hospital, which is currently without a CT scan machine, or a working one anyway. Yes, a child in my constituency had to be taken from children's to KPH because there's no CT scan at children's to do it, and ended up unfortunately passing. Mr. Speaker, the current administration seems to be
Yo, people, look on Christopher TUFTON face when I talk about the young Pitney were dead in the hospital because the machine never did it. And the man just sling on a smile. Me say, yo, I watch the debate and I tell you, say, I could have reached me and out. Yo, the brother anger my spirit, bro. The man don't give a shit about people's life, bro. The man a smile, bro. But, yo.
Averse to maintenance, whether it be roads or hospital equipment. Non-functional equipment is testament to their lack of attention to preventive maintenance. Broken and non-functional ventilators, ambulances, diagnostic equipment, even air conditioning units are usually the reason why critical services are not delivered. Simple things like that. Preventive maintenance is needed to prevent us from ever getting back to this situation again. Regular maintenance of standardized equipment will be a key priority for the next PNP administration. We will strengthen the health facilities maintenance unit through proper staffing and resources. Mr. Speaker, we recognize that there is little consideration for the immense value of volunteers who contribute in the health sector, medical missions from our wonderful diaspora, health fairs and voluntary work bring healthcare to thousands of Jamaicans annually. We want to recognize the efforts of these good Samaritans who make all this possible, not only by conveying our sincere gratitude, which we do, but by committing to making it easier for them to do the Lord's work. We will build out the services offered to facilitate the delivery of voluntary health care and cut through the bureaucracy that complicates and frustrates health donations. When I say I want to chair that task force dealing with the bureaucracy, that's a serious thing. Because there's so many areas where people are frustrated who want to do good things and can't do it because poor systems and old rules and things that are not fit for purpose, and this government is doing nothing about it.
Yo, may I tell you, say, you hear the man serious number.
For example, the next PNP administration will support health fairs and clinics so that no parent has to pay for school medicals for their child to attend school each September. It's an easy thing to arrange, and we will do it. For example, the next PNP administration will support health fairs and clinics so that no parent has to pay for school medicals for their child to attend school each September. It's an easy thing to arrange, and we will do it. Our commitment to improving service delivery over the promises of soon done refurbishments will improve healthcare delivery and save countless lives.
That's right.
We put people first, not the ribbon cutting of buildings.
For the next Prime Minister.
Will improve healthcare delivery and save countless lives.
That's right.
We put people first, not the ribbon cutting of buildings.
All this money and Jonas do a cut ribbon. That's all them do. Them do nothing else, you know. It's a optics thing with them. Them now bring no real change. Yeah, what Marky G say? You think say 10,000 house every year. You think say he can go cut? Him can go do 10,000 ribbon cut it. No, not depend that. Just go and make house people and make people get some affordable house. And you don't know the people will speak for you. The families affecting 10,000 family in a 1 year. 10,000 times 5, 50,000 people. If you do that every year, you talk about 50,000, 100,000, 250,000 people are like less than a quarter of the population, but still a significant amount. So what we are talking about? Them think they are real change. 1 degree of family. Yo, big up the PNP and big up Marky G and big up the whole team. No joke, we not take back no chat. Remember that.
Mr. Speaker, I move to the next subject. Jamaicans want new and...
Hey y'all, please remember to hit the like button. I know y'all come in sometimes and y'all forget, but the main thing, man, y'all gotta hit the like button, man, and share the live stream. Come on now, stop playing. Support. The like button is free, heard?